You know, when I tell this story, I can just see people in the audience gnashing their teeth, upset. Oh, folks, this is a horrible story. AP, brace yourselves. Obamacare means fewer health care options for illegal immigrants. What kind of country are we becoming? What kind of people are we? Who are we? How can this be? For years, Sonia Lemus would drag her daughters to the emergency room whenever they felt sick. As an illegal immigrant, she had no health insurance. The only place that she knew to seek treatment was the hospital emergency room, the most expensive setting for those covering the cost. The family's options improved somewhat a decade ago with the expansion of community health clinics, which offered free or low-cost care with help from the benevolent and godly federal government. But President Obama's healthcare overhaul threatens to roll back some of those services if the clinics and the hospitals are overwhelmed with newly insured patients and can't afford to care for as many poor families or immigrants. You see what's happening here, folks? Another sign of something we predicted that would happen under Obamacare. In a nutshell, AP trying to make several points here. Obamacare doesn't cover illegal aliens, and they are soon going to be the largest group without health insurance. And you know what that means? We're going to have to expand Obamacare to cover them. The second, the illegal immigrants will be second only to those who don't want health insurance. Some of the states that have the highest illegal alien populations are refusing to expand Medicaid. So this sob story article is implicitly arguing that since taxpayers are already paying for illegal aliens to get treated in the ER anyway, we might as well give them Obamacare. That's the point of the story. See, the story says right now, illegals can head on over to the ER and some of these clinics and get treated because the law says you show up to ER, you get treated, health insurance or not. But Obamacare is going to insure a minimum 30 million people who don't now have it. And what's going to happen then? Well, theoretically, when you give 30 million people something they don't now have, they're going to start using it. So when you give them these 30 million health insurance for the first time in their lives, they're going to start getting sick more often just so they can use the benefit. And they are going to clog up the ER. They're going to clog up the clinics. You have 30 million people who don't show up now because they don't have insurance are going to start showing up. And that will mean less space, less room, less availability for the poor illegals who don't have insurance because they're not covered, theoretically. Now, you and I both know that. And so when the word gets out that, look, illegals aren't covered and the Republicans and Democrats are moving fast on amnesty, can you see what's going to happen here? Why, we're going to have a brand new expansion of Obamacare that nobody even thought of except us. We told you, we warned you that this was going to happen.